And while health officials continue to stress the importance of getting the vaccine, they're learning communities of color across the Commonwealth and the United States are hesitant to do so. That's why community centers are working to educate people about the vaccine safety and benefits. Odessa Meredith joins us now in the studio with more about the kinds of outreach that are in place. Odessa.
Hi, Jill. Good evening. Local community centers serve a large portion of the community of color. They've seen the hesitation and are continuing to develop ways to educate everyone. Health professionals encourage the community to get vaccinated for COVID-19 at their first opportunity. Recent studies suggest that African American and Latino communities are less likely to do so. Health professionals from those communities say there's valid reasons as to why, one dating back to history.
I think it definitely has some historical background on how people of color were used for tests when it came to vaccination or diseases and things of that nature.
There's also the issue of access.
People are calling us morning and night. People are texting us. How do I get on the list? You know, where is the vaccine available?
Misinformation is another factor.
A lot of information was saying different things, and so people were confused and didn't know what to do.
Community centers are working to provide education to eliminate the many fears associated with the COVID-19 vaccines.
What we've been doing through the MCIC and through here at the Martin Luther King Center is trying to educate the community since this last summer, starting with campaigns in June, and just passing out information, testing, screening, talking about the importance of getting screened and getting checked.
And when it comes to accessibility, they'll continue connecting with area hospitals.
But for Allegheny Health Net reaching out and providing 120 vaccines for the Booker T. Washington Center, the Martin Luther King Center, and the Quality of Life Learning Center, we wouldn't have any public experience with providing the vaccine for these vulnerable populated people.
Until the centers are able to consistently vaccinate, they'll continue to offer free testing through weekly hospital partnership. Sean?
Odessa Meredith reporting tonight. Thanks, Odessa.